Hey guys, this is Dr. Hub. Today we'll look at the transverse and the vertical incisions in cesarean section. So first let's look at the transverse section. So first we need to have an understanding what is transverse. So this is the transverse incision. So what is the advantage in the transverse incision? So the advantage is that it follows the Langer lines of skin tension. So it is along the Langer lines of the skin tension, and so it has a superior cosmetic result. So it is cosmetically it is superior. It has a less operative pain. It has a decreased post-op pain. This is also an advantage. Then comes the less facial wound dehiscence. It has a less facial wound dehiscence. So what is the other advantage? It can also be the low incidence. So there can also be the low incidence, and this low incidence is of the incisional hernias. Now let's focus on the disadvantages. The disadvantages of the transverse section. So this will include there is a high infection. So the infection rate is significantly high, and there is also a narrow operating space. There's a narrow operating space. Then there is an injury is possible to the neurovascular bundles. And there is also re-entry. There is re-entry. The re-entry is during a repeat C-section is difficult due to scarring. So re-entry during the repeat C-section. So during the repeat C-section is difficult. So the re-entry during the repeated C-section is difficult due to scarring. Due to scarring, it becomes difficult. Now let's move on to the vertical incisions. So in case of the vertical incisions, what are the advantages? The advantages here, it includes the quick entry. So there is a quick entry, and there is also, so this is the vertical incision. So there is a quick entry, there is minimal blood loss. So minimal blood loss. It is a superior to the upper abdomen. It is superior access to the upper abdomen. There is a wide operating space. So in vertical, the advantage is the wide operating space. So what is the other advantage? There's flexibility for easy wound extension if necessary. There's flexibility for easy wound. Flexibility for the easy wound extension. This is if necessary. Now let's focus on the disadvantages. So this will be the disadvantages of the vertical incisions. The disadvantage is there is a poor cosmetic results. So there's poor cosmetic results, and there is a high facial dehiscence. And there is a high incisional hernia rates. There's high incisional hernia rates. There is also a greater post-op pain. There is a greater post-op pain. you.